All right, so we'll begin with day 29 of Alan's keynotes study streak. Today we'll discuss four remedies, and of which the first remedy is opium. We discussed Nux moschata, Nux vomica 2 days back. We discussed sanguinaria yesterday. Something that is an extension of sanguinaria, Nux moschata, Nux vomica, and you will see some symptoms of those remedies in our clinic will be from the remedy opium. So let's see how and when it is indicated and when will you prescribe it, and some clinical tips that you will be learning from my own experience of using these remedies. The very first line in Allen's keynote say that it is especially adapted for opium. It is especially adapted to children and old people, diseases of first and second childhood, like the remedies Baraitacap and Millefolium. Surprisingly, new remedy now we read. And persons with light hair, lax muscles, and want of bodily irritability. So you have a remedy which is more indicated to the children and also the extremes of the opposite of children's, which is geriatric age, the old people. This is a very valuable thing because you need to keep in mind those remedies like we discussed in Ethusa, Abrutinum, Sanicula, and many other remedies which are mostly useful in both the extremes of life, and they will have complaints more often and more more or less when symptoms don't lead to any other remedy. You should think of these remedies which are suited for extremes of life. So you have some mental picture of opium remedy. Let's go over and read. Delirium, constantly talking, eyes wide open, face red and puffed, or unconscious, eyes glassy, half closed, face pale, deep coma, preceded by stupor. Thinks she is not at home, like the remedy Bryonia, and this is continually there in her mind. Picking of bedclothes during sleep. If it is more while awake, this activity, it is Belladonna and hyos. And these are the other two remedies which we'll also be discussing. Delirium tremens in old emaciated persons, bloated face, stupor, eyes burning hot, loud snoring. Now, what picture you see in Allen's keynotes for opium is probably something that will come to you in neurological cases or patients who are mentally disturbed, and this is not the real picture which we will see in our clinic. It will be something which is a little bit different or diametrically opposite to what we see, what we read over here. Second thing is that there are some symptoms from this, which is what they consider in the mind method, and all these mind practitioners they usually pick up subtle metaphorical meanings of some symptoms and rubrics for prescription, but still it is very much interpretation dependent, and it will definitely mislead you or act for a short while and not for a long term. Basically, opium and the other remedies that we'll be discussing, stramonium, hyos, and belladonna, these are short-acting remedies, and we should think of these remedies as acute satellites of the deeper constitutional chronic remedies, or they should be thought for pushing the case when the case is not progressing. That should be the first attitude when we employ these medicines. Second attitude that we should always have is that uh, these remedies may work as a constitution but only for a time period and not forever, because these remedies don't have a state which is deeper dyscrasia which is going to affect the patient for a long time. Okay, so then we have want of susceptibility to remedies, lack of vital reaction. The well chosen remedy makes no impression. Carbovage, Lorocerasus, and Valeriana. These are the other three remedies mentioned, and opium is one of them. So, as I told you, you will need a push. In some cases, you will need to employ this remedy. But not all cases we should be using this remedy as a intercurrent. There will be a certain class of cases, especially those which have a kind of a physical pathology. physical general or physical particular which points towards hot perspiration or painlessness, or someone who does not complain of pain in the location where the pain should be there. Okay, so then we have all complaints with great sopor, painless, complaints of nothing, wants nothing. So it's interesting that you have some symptoms of the patient where normally he should be experiencing some pain, but he does not experience. Those are the cases which should lead you to prescribe opium rather than just all the cases where you will be employing opium. But there should be accompanying sleepiness, there should be feeling that he does not want medicine or does not want any particular thing, which should always be iterated by the patient again and again rather than we interpret it that he does not want something. Sleepy, heavy, stupid with stertorous breathing, red face, eyes half closed, bloodshot, skin covered with hot sweat after convulsion. So I shared with you how we will need to give it in cases where there is sleepiness and there is lot of hot perspiration. Think of this remedy when it is such a case. Sleepy but cannot sleep, like the remedies Belladonna and Chamomilla. Sleeplessness with acuteness of hearing, clock striking or cocks crowing at a distance keep her awake. So you will see that some children and also some old people who will always be active, awake by the least movement, by the least noise. Those are the cases that have acute sensitivity, or they will have the diametrically opposite situation, which is dullness of senses. Opium will be indicated in extreme polarities and both the poles. In fact, you will see both the polarities at one time in the same patient also at times. The bed feels hot, she cannot lie on it. If the bed feels hard, the remedies are arnica, bryonia, pyrogen. If it feels hot, the remedy is opium. He often moves in search of a cool place, must be uncovered. So there will be a certain class of patients who will always avoid coverings. Those are the cases that will require opium as an intercurrent or as an acute in their uh, acute manifestations. For them as a chronic remedy if they are not children or old age. If they are in middle age, then for them to prescribe chronic medicine would be difficult for us to sustain it for a long time. Then you have something which is marasmus, where child is having wrinkled skin, looks like old dried up man. This we also saw in opium. Okay, so then we have in the Allen's notes for the remedy opium, deep stertorous breathing, respiration on deep stertorous respiration both on inhalation and exhalation, and loss of breath on falling asleep. Like the remedies Grindelia and Lachesis. To those children or those patients who always go to sleep but get aggravated by the respiratory distress, they should be thought of opium. This is very close to antimtat, and if you ask me what is the difference between antimtat and opium, I would say that it's the hot perspiration in opium and cold perspiration in antimtat, which should point you towards differentiating both the remedies. In gastrointestinal system, we see digestive organs are inactive, peristaltic motion is reversed or paralyzed, they will have erectations, they will have discomfort in the abdomen, and the bowels seem closed. So, as much as laxatives they have taken, it has not worked or it has done the opposite, it has given them diarrhea. So, we'll see in the further steps, further symptoms. Constipation of children, of corpulent, good natured women, constipation from inaction or paresis, local paresis, no desire from lead poisoning, stools are hard, round, black balls, chelidonium plumbum thuja. Feces protrude and recede like the remedy silica and thuja. Stools is involuntary, especially after fright, black and offensive from paralysis of sphincter. Opium renders the intestines so sluggish that the most of the active purgatives lose their power. Persistent diarrhea in those that have been treated with large doses of this drug. So you will see that uh, if the system is inactive for a long time, there will be a kind of a stasis that ensues, and if there is even ex- excretion which is coming out, it will be decomposed, decayed, or black in nature, which is what we see as black stools. In fact, the normal stool, which is usually slender and soft in consistency, that would be turned into balls because it is there in the anal canal for a long time and it is not been expelled at the right time. So kind of the mucous membrane itself breaks it into pieces, and then it tries to throw it off, or there is no consistency to form a correct stool. And you will also have patients who develop diarrhea from these large doses of laxatives. They will need opium. They will need not opium not as a constitutional remedy but as a acute or subacute remedy to push the case forward. Then you have again urine which is retained, like the stools which were retained, the bladder being full over here, retention, or it is postpartum immediately after delivery, and there is also painlessness after delivery because of the anesthesia. We should think of opium. Excessive use of tobacco will cause issues. In nursing children, it will cause issue after passion in a nurse, or in fever or acute illness, paralysis of sphincter or bladder. So you see that the children who usually have been feeding on their mothers, if the mother has more emotions, more anger or fright, those are the cases that will develop some sort of urinary problem, and you should think of opium as the medicine. In stramonium, we have suppression, while in opium, the secretion is not diminished, but the fullness is not recognized. So it is almost similar to the earlier symptom that you read, which is painlessness of complaints that are usually painful. There is ailments with insensibility and partial or incomplete paralysis from fright. So the one of the very important thing for opium is that there is ailments from fright, ailments from bad effects of fright, even though it has happened long back or it is recent. If it is recent, it is more of aconite. If it is long back, it can be opium. But the fright has to cause a sense of a fear and make the patient feel that as if uh, as if there is nothing else left for him to do and it's time to die. That will be the fear some people usually have when they experience fright. If they feel fright and it's just fright, they can't explain beyond uh, when we try to decipher from them what is the exact feeling, then maybe we can think of aconite. But if it is more deeper feeling that they feel that as if I would have died, or as if I would have uh, I felt completely blank after it, some more expressions which also belong to the family of opium, which is papaver, and the same family is there for sanguinary as well. So you have these similar traits coming, and fright causing many effects on the body. Think of opium also. Also, you'll have ailments from charcoal vapors, inhaling gas, drunkards, and spasms of children from approach of strangers, from nursing after a fright in the mother. I already spoke about it. This is the similar case with hyos. If it is there after anger in mother, chamomilla and nux vomica can be thought. And if the patient is also having convulsions with it, we should think of, with the eyes half open and upturned, we should think of opium very strongly. Before the convulsions come, they will usually shout very much. They'll kind of scream a lot. That should be an invaluable indication for opium. You can ask that from the patient or the relatives. Mostly the relatives will answer this more affirmatively. This will be the similar scenario in cases of apis and helleborus also. Sudden cessation of acute exanthema or any skin problems, I would say, causes convulsions in the brain and will cause lot of effects in the opium patient, like the remedies in metallicum. Aggravation for opium we see during and after sleep. Epis and lachesis also have similar aggravation. And if he has perspiration, there is aggravation. There is warmth, there is aggravation. If they take stimulants, they will have aggravation. Amelioration from cold and constant walking, and nux vomica and constant motion will kind of more relieve opium patient. You also need to compare when opium is there in your mind. You should compare apis, of course, belladonna is another remedy, hyos, stramonium, and zincum. So very similar in picture we see also in stramonium, which is the next remedy we will take up. So let's move on to stramonium. And if we read from Allen's keynotes, it is adapted to ailments of young plethoric persons, like the remedy aconite and belladonna. So I would say that this is one of the satellites of calcarea carb. We will see that in the due course when we read it, especially in children, in chorea, in mania, and in fever delirium. So there is delirium, loquacious, talks all the time, sings and makes verses, raves, stimulants, belladonna and simulates belladonna and hyoscyamus, yet differs in degree. So many cases will have lot of similar symptoms, which is they will be violent, they will be cursing, they will be loquacious. Same symptoms are there in belladonna, the same symptom is there in hyoscyamus, stramonium. You will need to differentiate from different angles, and we will see it in today's session by taking the other remedies into consideration also, how it is going to be helpful to prescribe stramonium and the other remedies respectively. So let's read further, and we see that the delirium is more furious in stramonium. They will have visuals, imaginations. The mania is more acute, and the congestion is greater than that of hyoscyamus, but less than that of belladonna. If we see the pathology of the patient, it will not be a true inflammation, but it will be more of a psychoneurotic origin or psychosomatic in origin in nature. And that is what we should think of when we prescribe these remedies. Some remedies go deeper in the economy of the body and cause destruction, changes in the tissues. Keep those remedies separately in mind. Some remedies will act on the psychosomatic plane, on the mental level, and the disease has not progressed on the pathological level. So think about those remedies in those cases. So more about this, these are just very primitive ideas, and I am planning to put this on paper and bring it out sometime in future. So the patient is disposed to talk continually. Cicuta, lachesis are the other two remedies. They are incessant in talking, incoherent in talking, laughing, praying, beseeching, entreating with suppressed menses. So all those cases where there have been more of delirium, loquacious talks, and there is an element of uh, suppressed menses also. You should think of stramonium very strongly. It will probably even bring the menses, but the psychoneurotic element has to be very strongly observed by you. Desires light and company. It will be direct interpretation what what is mentioned, that they need light, they cannot stay in dark. They need company, they cannot stay alone. In the mind method interpretation, they have taken it otherwise. Desires light is considered as something that is more of the patient requiring more information about his disease by doing some investigations, by doing some tests. This is another way of thinking. So there are many ways of thinking about a remedy, and these are the two top ways which currently many homeopaths are thinking this way. So the patient of stramonium or the remedy stramonium is worse in dark, solitude, and cannot walk in a dark room, which is what we see most of the children are affected with. And maybe if it is too high in degree, then stramonium should be indicated or given. If it is of a minimal in nature, then don't just jump into the ship and give stramonium just because he has fear. It is normal to have fear at such an age, but if it persists for a long time or if it is too big enough that everything else is ruled out, then think of prescribing stramonium. Awakens with a shrinking look as if afraid of the first object seen. So imagine if you are woken up suddenly from the sleep and someone tries to scare you off, or you slept in the bed but you woke up on a road. It's like that. Some vehicle is coming and you are suddenly waking up, and then you actually wake up in your bed and you see that it's a dream. So it's like that. The stramonium state is like that. They wake up, they have a scared look on their face, they'll be praying, they'll be talking loquacious, and they'll be in delirium. Hallucinations which terrify the patient, which is what I described. Desire to escape in delirium, like the remedies Belladonna, Bryonia, Opium, Nurse talks, imagines all sorts of things, that she is double, that she is lying crosswise, etc. etc. We also saw this in petroleum. Head feels as if scattered about, very vague symptoms, very vague sensation. Maybe once in a while you will experience, like the remedy baptisia. There is hydrophobia, fear of water, and excessive aversion to liquids. Also seen in belladonna, also seen in lysinum. Now imagine there is such a state where there is loquacity, there is fear. This fear is causing disturbance on the physical level. So stramonium is a remedy which will affect the mind more than the physical body. Everything is centered in the mind and the nervous system. That is the reason they will have stammering. So we come to the next symptom, which is stammering. Has to exert himself a long time before he can utter a word. Makes a great effort to speak, distorts the face. There is a very nice movie I would recommend if you all can watch, The King's Speech. And in this, there was this fear of in the newly crowned prince, king, where he had to deliver a speech, and the entire story is about that, how he becomes the king and uh, overcomes that fear. So the state of stramonium is not exactly like that, but it was all about speech, and this is where we come to in stramonium also. They, from the mental aspect, they have a fear constantly. It's not about timidity, but it's about a fear which they have in their mind, which they feel that may cause them to fail, or how will they present themselves. And it's more of a nervous in nature, psychoneurotic in nature. So it will, they will have this kind of a stammering, and it will be more of like 2 to 3 words repeatedly in the beginning, and then they will set it right, and it will keep on recurring. Whereas the stammonium that whereas the stammering that you see in lycopodium will be more of initial part is very weak, they fear, they stammer, but later on, as they begin, as they start, they will become more fluent, and it will be the best speech ever. Whereas in stammonium, they will keep having stammering again and again in every sentence. If they have stammering in the last part of the sentence, then the remedy is spigelia. So one of the remedies mentioned in the relationship is spigelia. Other two remedies are ignatia and bodista. No pain with most of the complaints in stramonium. Painlessness is characteristic, like the remedy opium. Sleepy, but he cannot sleep. Belladonna, chamomilla, and opium are the other remedies. So, Dr. Parul, good to see you here. And comparison book Materia Medica name बताइए. तो ऐसा है कि मैं जो जो शेयर कर रहा हूँ आपको, वो बहुत सारे किताबों में से है, एक किताब में से नहीं बता रहा हूँ मैं. मेरे एक्सपीरियंस से बता रहा हूँ, रेपर्टरी से बता रहा हूँ, मैंने जहाँ जहाँ पढ़ा हुआ है उसके थ्रू से बता रहा हूँ. So it is not just one book which I am referring, it is multiple sources and my own experience, the seminars that I have attended, the seminars I have visited, I have taken, the college sessions, etc., etc. And from that, it is all coming. Maybe you can find a few books like different books, and you will need to compare and read the remedies. So there is not one book which I would say that it's really good for comparison. You will have to study all the remedies, then study all the related remedies, and find a comparison yourself. It's not a one day job, it's not a 1 week job, it is a job which is requiring uh, maybe 6 months of total dedication towards materia medica, towards your repertory or any subject that you would like to excel in. In fact, for homeopathy, it's a lifelong student that you can be, and you will evolve as the times grow rather than in just 1 day or 1 week or 1 month. So next we have in stramonium, eyes wide open, prominent, brilliant pupils are widely dilated, insensible contortion of eyes and eyelids. So they have a fiery look, fiery. It's not that they are scaring the other people, but they are already scared, and the eyes will be wide open and prominent, and you will see that the pupils are also dilated. And if the child is reprimanded, the pupils will dilate. This will be a observation of the physician. If the child is shouted upon in the clinic, if he is doing some vague behavior, or else if there is some sort of explanation from the relatives that suffices to give you this explanation. Then you have face hot and red with cold hands and feet. In opium, we see that the entire body would be hot or it will be hot in spots. Another remedy which also has hot in spots is sulfur. In stramonium, there will be more of face which is hot and red, and and feet which are cold. The cheeks are circumscribed and red, and blood rushes to the face and rises sardonical. This is a clinical condition which is given, but nevertheless, the state would remain the same. Spasmodic constriction of throat, vomiting as soon as he raises the head from the pillow, and from a bright light. So the light kind of aggravates stramonium so much that they would even have vomiting and convulsions also. So we have next is convulsions in Allen's keynotes for stramonium. Convulsions are with consciousness, they know what is happening around them, they don't go into stupor like opium does, like cuprum does, or like the other remedies of convulsions will happen. Nux vomica is also one of the remedies which will have convulsions with consciousness. If it is without consciousness, the remedies are belladonna, cicuta, hyos, opium. And you see that renewed by bright light is very strong aggravating factor for stramonium. And by shine of mirror or by looking in mirror or water also aggravates, like the remedies belladonna and lysinum. And like we saw in causticum, there is single muscle paralysis, single muscle twitching is there. So all those patients that come to you with stammering, with weird expressions of the face and some twitches in one part of the body due to nervousness, think of stramonium for them as a very strong indication of remedy, especially the upper part of the body, which is a clinical condition for chorea. Aggravation in the dark when alone, looking at bright shining objects after sleep, which was also the case with lachesis, apis, opium, and spongia. And when they attempt to swallow, they have problems. Stramonium has a problem. Stramonium will have amelioration from bright light and company and warmth. Interestingly, bright light causes issues but also causes them to feel better because they fear dark. And everything starts from fright, that which is what they want to avoid. So, related remedies we see belladonna, cuprum, hyoscyamus, and lycinum are very closely related. And if belladonna is given too frequently in some cases of cough or respiratory distress, try to give stramonium, it will kind of relieve the issues. And also, stramonium If it fails in some cases where post delivery it is given for retained placenta, then CKL would probably help even better. So let's go to the next remedy, which is hyoscyamus. And from what we remember being read in the different books, it is a remedy which stands between belladonna and stramonium. So, and I have been speaking about the cough which hyoscyamus has from many days. So let's read: persons of sanguine temperament, persons who are irritable, nervous, hysterical, diseases with increased cerebral activity but non-inflammatory type. So I already shared with you, you will need to classify remedies into pathological remedies and non-pathological remedies. Okay, and remedies which will cause, those would be, that would be non-pathological, would cause changes on or more or less functional level or nervous level, and pathological remedies will cause inflammation or disturbance at the level of tissues. And if you try to categorize your remedies into those sections, your job of prescription becomes very easy, because in clinic you will probably get more of functional cases initially and then pathological cases. There will be a ratio, like say 8 cases out of 10 would be functional, 2 cases would be pathological. So you will need to define your sphere of action from the remedies that you have segregated into two parts, and also that could be acute and subacute and chronic. So three categories for the remedies point of view, two categories, two main broad categories for the disease point of view: pathological and functional, and then and non-pathological. And in non-pathological, it will be functional and nervous system related, and in pathological, it would mostly be what are the tissues that are affected and at what level the affection is, whether it is first degree of inflammation, second degree, etc., etc. So in hyoscyamus that we are reading right now, we see that there is kind of a increased cerebral activity but non-inflammatory type and hysteria. And then we read something that is interesting, which is in delirium the hyoscyamus tries to occupy a place between belladonna and stramonium. So it is a remedy which I would say is having a combination of pathological and functional disturbances, but more of functional disturbances than the pathological changes. Then you have further is something that is, it lacks the constant cerebral congestion of belladonna and the fierce rage and maniacal delirium of the later remedy, which is stramonium. Fears being alone, like we saw in stramonium, hyoscyamus also has the same fear, but he also has an additional fear. In stramonium, we saw that there is more of a fear of dark, of something that will happen to him if he's alone. But in hyoscyamus, there is more of poison, of being bitten by something, being sold or being injured, or if someone is offering something, he's very suspicious. The highest remedy which has the highest degree of suspiciousness is hyoscyamus. In fact, there are siblings who feel jealous, who feel suspicious about their other sibling. Think of hyoscyamus. There are children who will be suspicious or jealous of something that is happening between the parents. You can think of hyoscyamus, other remedy being ignatia. Uh, why does this state happen? Because they see that the parents are not giving them attention and giving more attention to themselves, which is what causes these problems. Bad effects of unfortunate love, with jealousy, rage, incoherent speech, or inclination to laugh at everything, often followed by epilepsy. So there was a case which I had where there was a lot of convulsions, and the whole story started in the past where the second child was born and the first child started having epilepsy because more attention was given to the second child which was newly born. So it's a very perfect case of hyoscyamus which you have in your clinic, and you would not miss such a presentation. Then we have something which is on the sexual sphere, lascivious mania. immodesty will not be covered, kicks off clothes, exposes the person, sings obscene songs, lies naked in bed and chatters. There is intense sleeplessness of irritable, excitable persons from business embarrassments, often imaginary. So, normally in patients who are having lot of business stress, we think of giving them Kali first. We think of giving them Nux vomica. Hyoscyamus is often ignored. Mostly, the feelings of Hyoscyamus are imaginary. Everything is going well. The business is going good. The the place is going. The place is at a. The business is at a good place. The sales are good, etc., etc. The bank balance is good. Everything is good, but it will have some. The person will have some imaginary troubles, imaginary thoughts about the business going bad. Those are the cases where you'll need to give hyoscyamus. It will be available. These histories will be available after we get to know from the patient. Cough, which is dry, nocturnal, spasmodic, aggravated when lying down, relieved by sitting up. I have been speaking about it in various remedies, like the remedy Drosera. Drosera will keep continuing to sleep in the cough bout, whereas hyoscyamus would even get up and spit out. Also, the other remedy which will get up is sanguinaria. Aggravated at night after eating, drinking, talking, singing. Similar presentation we see in Drosera and Phosphorus, and if they feel better by lying down, it is manganum. Also, there is causticum which will have better by lying down. There would be paralysis of bladder after labor with retention or incontinence of urine, no desire to urinate in lying in women who have been operated and then they don't have the desire to pass the urine. This is similar to opium. You will be have to narrowly differentiate. If there is more of hot perspiration, think of opium that would have. Other remedy also being arnica. Convulsions of children from fright or irritation of intestinal worms, like the remedy Sina, during labor and also during the puerperal stages after meals, child vomits, sudden shriek, and then insensible. So we saw that there is a screaming element and then going into convulsion. It was there in stramonium, it is there in hyoscyamus as well. Spasms without consciousness. There we had with the consciousness, here it is without consciousness, very restless, and every muscle in the body twitches from the eyes to the toes. Everything is twitching like little butterflies, troubling everywhere. Fever, pneumonia, scarlatina rapidly becomes typhoid, sensorium clouded, staring eyes, grasping at flokes or picking bedclothes, teeth covered with sores, tongue dry and unwieldy, involuntary urine and stool, and subsultus tendinous. At night is the aggravation for hyoscyamus. During menses, aggravation, mental affections cause issues, jealousy, unhappy love, and when lying down causes issues. You can compare hyoscyamus with belladonna, stramonium, and veratrum. And nux vomica and opium are also very closely related. And hyoscyamus follows well belladonna, which is also indicated in deafness and apoplexy cases. The last remedy that we'll discuss today is belladonna. Actually, it is one of the top remedies which everyone begin talking about in all their lectures. But I've come to this now because something related to belladonna we have discussed today, and it is time for belladonna to open its account today with us. So we have in belladonna for from the Allen's notes, something that is it is adapted to bilious, lymphatic, plethoric constitutions. Persons who are lively and entertaining when they are very good and well and in healthy state, but they are violent and often delirious when sick. So at one moment in their healthy nature, they are very happy, they are very smiling, happy-go-lucky, but in the other moment, they are very sad, very delirious, and that is the state that you can get from the parents, the patient himself, or the relatives, and then you will probably think about prescribing belladonna. Women and children with light hair, blue eyes, fine complexion, delicate skin, sensitive nervous threatened with convulsions, tubercular patients. Imagines he sees ghosts, hideous faces, and various insects like the remedy stramonium. Black animals, dogs, wolves, all sorts of imaginations you will see in belladonna, you will see in stramonium, you will see in opium also. But you will not see more of these imaginations in ISMS because it has a different kind of presentation. Fear of imagination, imaginary things, wants to run away from them, hallucinations, violent delirium, disposition to bite, spit, strike, tear things, breaks into fits of laughter, gnashes the teeth, wants to bite and strike the attendants like the remedy stramonium, and tries to escape like the remedy helidolus. So children who are very snappish, who are inclined to make noise, who are in their in a world of their own, and they don't respond to any parental uh, opinion or any parental guidance. Those are the cases that will require belladonna. It is not a remedy which will probably work as a constitution, but with the constitutional remedy you can give it in between every month or 15 days, one or two doses, and it will kind of smoothen the economy of the patient. The mind will be settled. You have to understand that there is a kind of cerebral hyperactivity which we need to control. The constitutional is doing its work at the level of the body, the tissues, the other parts of the body, but the violent cerebral activity needs to get into control. And these remedies, belladonna, stramonium, hyoscyamus, will bring the activity to normalcy. If it is extreme opposite, which is cerebral inactivity or dullness, opium would probably work better. So, reading further, we have great liability to take cold, sensitive to drafts of air, especially when uncovering the head from having the haircut. Tonsils become inflamed after riding in a cold wind. So, anything that has exposure to the upper part of the body, or especially the head from here to the this part, that has belladonna indicated for you. Don't think further, give belladonna in the highest potency 1 m or 10 m. You will see the results within a few hours. You will see that there are other remedies which are very similar, but they have different presentations. Aconite, hepa, and restox have been given, but for them it will be any other part of the body which is uncovered and causes issues. For belladonna, it is just the head. If it happens from exposure of feet, the cold happens from exposure of feet, you should think of conium, cuprum, and silicum. Then we have in Allen's notes for belladonna, quick sensation and motion, eyes snap and move quickly, pains come suddenly, last indefinitely, and cease suddenly. Now there are many remedies which will have different types of pains. You need to understand from the nature of pains described by the patient or ask the relatives about it. Other remedy also similar over here being MacFos. Pains usually in short attacks cause redness of the face and eyes, fullness of the head, and throbbing of carotids. So everything that is affecting the head, the entire head, and also everything that affects the upper part of the body has belladonna indicated for you. It will be cerebral congestion, it will be fullness of the face with the blood vessels, and it will be liability to take cold, etc., etc. Think of belladonna in those cases. You will also have vertigo when stooping or rising after stooping position and on every change of position like bryonia. Then again, you have rush of blood to the head and the face, causing a lot of issues. Amylum nitrosum, those patients that drop in your clinic for high blood pressure, that has happened immediately. Till yesterday, I was fine. It started suddenly. Think of belladonna in those cases. Glonine, amylum nitrosum, and melilotus are the other remedies you should think of. Headache, which is congestive in nature, with red face, throbbing of brain and carotids, like the remedy melilotus, aggravated from slight noise, jar, motion, light, lying down, least exertion, and better by tight bandaging or pressure and wrapping up. And they also feel better when there are menses and the headache is ameliorated. There is so much of a cerebral congestion and pain or discomfort that they bore their head into the pillow, which is what we also see in Apis, Helleborus, and Podophyllum. In the gastrointestinal system, for belladonna, we have abdomen which is tender, distended, aggravated by least jar, even of the bed, obliged to walk with great care for fear of a jar, pain in the right ileocecal region, aggravated by slightest touch, even of the bed cover, the transverse colon protrudes like a pad. Skin of a uniform, smooth, shiny scarlet redness, dry, hot, burning imparts a burning sensation to the examination hand. The true Sydenham scarlet fever, when eruption is perfectly smooth and truly scarlet, this was seen like say 100, 200 years ago. But in today's age, you will see that there is dry, hot skin which is perspiring a bit, and in aconite you will see the opposite, which is just the dryness and no perspiration. Pressing downwards as if the contents of the abdomen would issue from the vagina, from the vulva, better by standing erect or sitting erect, and worse, especially in the morning. Other remedies being lilium tichinum, murex, and sepia. Feet are icy cold for belladonna in fever. You see that the head is hot and painful, face is flushed, eyes are wild, staring, pupils dilated, pulse is full, bounding, globular like buckshot striking the finger. Mucous membranes of the mouth are dry, stools are tardy, urine is suppressed, sleepy but cannot sleep. So, lot of symptoms are crammed into one place for belladonna. Every symptom has its own significance. You will not see everything together. In fevers, it is even more of a challenge. I'm conducting a workshop in the month of August from August 15, 5 p.m. to 6:30 p.m., 1.5 hour, 2 days a week. You can join. Those who are interested, send us a message and we will send you the details of how you can join. But there will be more discussions about nitty gritty things of fever, and then only you will be able to, you know, segregate the lot of symptoms from the fever cases. Also in belladonna, for Allen skin, from the Allen keynotes, we have convulsions during the teething period with fever that come on suddenly, head is hot and feet is cold. Aggravation for belladonna we see is from touch, motion, noise, draft of air, looking at bright shining objects after 3 p.m. and at night after midnight while drinking, uncovering the head, and summer sun and lying down causes aggravation. Amelioration from rest or standing or sitting erect and warm room. Complementary to calcarea. So in the calcarea carb remedy which I discussed in the early days of starting of this Allen Skinner study streak, I had shared that Calcarea Cub has many satellites. It has Belladonna, Rustox as the top satellites which work for it in acute cases. It has borax, which will work in the mouth case or aphtha cases. It will work. It has cuprum metallicum, which will work more of in the nervous system cases. So similarly, calcarea carb being at the center, it will have different remedies which are at its periphery, and you will need to switch over to those remedies and come back to calcarea in cases of constitutional prescribing to make an effective and successful cure for the patient. So, belladonna is the acute of calcarea, which is often required to complete a cure. Similar, belladonna is similar to aconite, bryonia, cicuta, gelsemium, glonine, hyoscyamus, melilotus, opium, and stramonium. So, in this way, we complete four remedies today. Opium, we started with opium, which has dullness or no activity or inactivity. Then we covered stramonium, which has elements of no activity or painlessness of complaints rather. And then there will be more of a fear and fright which causes issues. Then hyoscyamus, which has more of a fear of being injured or being poisoned by something, and lot of suspiciousness. The delirium is more of a cerebral type rather than inflammatory type, whereas in belladonna there is more of a inflammation and more of a first stage of inflammation which you read in the pathology textbooks. That is what belladonna is all about, anywhere in the body, and the remedy is belladonna. So that brings us to the end of today's session from Alan's keynotes for four remedies, and let us meet again tomorrow to discuss about some other group of remedies and which are mostly related. It will start at 5 p.m. again tomorrow evening. So see you soon till then.